Good day, ladies and gentlemen. We are the Group 3 and our topic is about online class on pandemic impact on students' mental health. Online classes or courses are conducted on the internet or virtually and what we are currently performing across the universe. On the other hand, mental disorder is an emotional, psychological, and social well-being that are part of our mental health. Mental illnesses have an impact on how we think, feel, and act. It also influences how we deal with stress, interact with people, and make decisions. Mental health illnesses started to grow since the implementation of online classes. Depression is one of the factors that students have been dealing with. Nowadays, online classes are implemented and many students have been experiencing mental health illness, specifically depression. It is one of the factors that students have been dealing with. Online classes cause the students to experience depression. That is because of having a hard time adjusting to a new school system, a scarcity of technical resources, high internet fees, sluggish internet connections, family financial insecurity, and mental stress on students. Depression can strike at any age, although it is most common between the ages of late adolescence and mid-20s. Women are more prone than males to be depressed. According to some research, 1/3 of women will have a severe depressive episode over their lives. When the first-degree relatives suffer from depression, there is a significant degree of irritability, about 40%. According to Mamon et al. 2020, the abrupt change in the learning environment has shaken both the efficacy of the educational system and the well-being of learners. The overwhelming emotional stress brought about by the pandemic and the lockdowns have even led more people to be susceptible to mental health issues and attempting suicide. According to Bautista et al. 2020, stresses and the different factors that contribute to learners' mental health declination during the pandemic, and these are COVID-19 issues, social media, money, family and peers, and being home quarantined. The result shows that 35% among the respondents think that the rising of COVID-19 issues overwhelmed them, thus causing fear and wobble their mental status. According to Manlunas et al. 2021, investigation on the emotional stability of senior high school students at the University of San Carlos in Cebu who engage in online learning during the COVID-19 pandemic, the result shows that the students with low levels of stress management and emotional stability significantly affects the students' mental health. Thus, the importance of this topic to be undertaken. Recently, there is an increasing awareness towards mental health. And through undertaking online class on pandemic impact on students' mental health, the team can help to eradicate the stigma circulating due to the socially constructed views on mental health, as well as easing self-stigmatization. Furthermore, stigma and discrimination are negative consequences of ignorance and misinformation. Through carrying out this topic, researchers can add information and understanding on the manifestation of psychological problems and provide possible approaches or strategies to overcome mental struggle. Hence, this investigation would aid in determining the cause of depression and how to address it. Will provide insights further into circumstances within the matter. This will benefit everyone who are experiencing depression as a result of the pandemic. People who have mental breakdowns and are terrified doing something.
According to Torales et al. 2020, with the global development of the coronavirus disease COVID-19 outbreak, a psychological issue which accompanied this pandemic have rapidly compounded its public health burden. When COVID-19 outbreak started to spread worldwide, many people, especially students, experienced mental health disorders. Under normal circumstances, higher levels of mental distress and negative academic effects are common. When schools around the world shifted face-to-face classes to online classes format, students' academic pressures are likely to further increase. As a result of this, the COVID-19 pandemic has put a huge mental health distress on students. This article talks about mental health distress students experience during the COVID-19 outbreak, on how it affects many students during online class format. Many of us are new to online learning. There are certain issues that must be handled carefully. Some mental disorders like depression may affect students by maintaining strict academic performance, physical distances, and isolation. It will have negative effect on students' learning experience.
According to McCluster et al. 2020, schools frequently give structure and safety to pupils, but this is especially true for students with disabilities, children and young people who are at risk. The COVID-19 pandemic has occurred, created tremendous disruption in society as a whole. Yet, it is obvious that the consequences are unequal, and that certain groups have been more directly affected. It had a detrimental influence both in the UK and abroad. While there is presently much useful quantitative evidence on the impact of COVID-19 on schooling, there has been minimal in-depth qualitative research that explores the young people's experiences and views as students, particularly the impact of school closures and test cancellations on their mental health and well-being. The article talks about the impact of COVID-19 on the students, which is very relevant to what is happening right now, not just in our society but in the whole world, which would aid in mitigating the impact of worldwide pandemic on their school-based mental health and well-being.
According to Iplan et al. 2020, depression is very frequent among college students. College students are a unique population that is transitioning from youth to maturity, which can cause stress in their lives. College students struggle to fit in, make plans for the future, and being away from home sometimes creates anxiety and fear. This article talks about depression among college students, which is very common due to the transition from adolescence to adulthood that can create stress in one's life. In addition, the article focuses on how COVID-19 changed the daily routines and activities of the students. It overwhelmed their abilities to do things, which also led to a dramatic drop in grades. Grades are also affected when someone is experiencing depression.
Hi everyone, I'm Cristina Idilio and I'm going to discuss about a review of related literature about the online class and pandemic impact on students' mental health. According to Islam, Barna, Ryan, Kenneth Hussein of February 2020 states that students were experiencing heightened anxiety and depression. They suggested that financial problems and academic delays are some of the factors that affect their mental health. Due to the pandemic, establishments have closed to business, resulting in many people losing their jobs and ability to provide for their families' needs. Often, students are having a hard time dealing with academic delays, which make the students suffer from mental illness. Furthermore, financial problems are a huge impact to the students because some students cannot pay for their online learning modalities and laptop, which is for virtual classes.
According to Fawad Sumaha, 2020, remote learning has been adopted as an alternative to fill the academic gap the pandemic has caused. Learning online platforms have given rise to depression and anxiety in undergraduate students. The sudden shift of online classes has produced fear and depression. The sudden change in the learning environment has affected many students, allowing them to generate symptoms and factors that brought depression. Having a lot of workload results in stress that they forget to take care of their mental health. Dealing with online classes is not an easy task to do. It needs time for adjustments and financial stability. The sudden implementation of online classes produced some fear and pressure on the students, which led them to suffer from depression.
The World Health Organization warned that stress, anxiety, and fear would increase due to the COVID-19 pandemic situation. Fear and stress of being infected, along with the pressure caused by lockdown, prevention protocols, and the economic downturn, increased tension among people, which consequently led to the increase in the incidence of mental instability. Staying at home made people, and especially us students, vulnerable to the adverse mental health consequences of isolation, personal and family problems. Research showed that there is a rise on suicide rates, anxiety, and especially depressive disorders worldwide. Amidst the pandemic, there is transition in the educational setting and learning system as a mitigation measure against COVID-19. Students are now engaging in online learning, and being online means using technology to acquire education. However, the excessive use of social media and technology may engender impaired social interactions and an increased sense of isolation. Humans are social in nature, and that clearly shows in the study of Maria Gomez, which tackles on the influence of social support to students' learning and development. And they found out that the absence of social and emotional support can compromise the students' development, including their mental health. Coping with the new school system and having a hard time adapting to the online needs are leading the students to experience depression. According to the findings of Henny Morgan, who dwelled on alleviating the challenges with remote learning during pandemic, many students have experienced learning setbacks because their families cannot afford computers or high-speed internet. In our country, students suffer as COVID-19 school shutdowns drag on because, as based on the result gathered by the study of a Filipino researcher, the challenges encountered by the students include lack of guidance and supervision, poor internet connection, and limited access to technology. And these factors cause the escalation of depressive behavior among students. A nationwide study reported that 22% to 32% in 3,670 Filipino students have difficulties adjusting to new learning styles and do not have access to reliable internet, and others experience difficulty in availing facilitative learning device. Despite the effort to make education accessible for every student, especially during this pandemic, there are still many difficulties confronting Filipino students in practice of online learning, which exacerbates the existing inequalities in acquiring education, and these challenges may threaten the students' mental health. Recently, the World Health Organization released a report that COVID-19 pandemic triggers a 25% increase in prevalence of depression worldwide. These should serve as a wake-up call to all countries, to everyone, to step up mental health services and support to minimize the risk factors that contribute to the onset of mental disorders.
For our objectives, the team conceptualized a seminar entitled online class on pandemic impact on students' mental health. To provide a platform for the discussion of depression, specifically, the seminar aims to 1. Spread awareness about depression. 2. Discuss the importance of depression. And 3. Understand why depression impacts students' mental health.